of all, Mercy Corps was very fortunate to get in very quickly. We have a great team of first responders, life-saving activities like providing clean water. We were able to get a pretty early slot in terms of getting in there. And we're able to get on some Black Hawk helicopters that were being flown in by the Homeland Security Department. These pictures here are actually of the, one of the hospitals. Mercy Corps started working quite early on in the first few days at the General Hospital, which is the largest hospital in Haiti, and had thousands of patients. And it was a situation where the building itself had been damaged, so many of the wings were not able to keep the guests, or I'm sorry, the patients, and so they were out in parking lots, they were out in the courtyard. They were just as far as your eye could see, people just taking any space they could. Doctors and paramedics performing pretty sophisticated treatment literally in the middle of a parking lot. With someone just standing by who happened to be a volunteer. I saw a child get a full body cast put on, and they were just holding the child down without access to painkillers, and just, it was something like, I was telling a friend, I said it was like that scene in Gone with the Wind after the Civil War, and you can't believe just the number of injured people that were there and needing assistance. And the big problem in the hospitals, I mean, aside from obviously all the medical problems, was that there was absolutely no food. And families had come there with their loved ones who'd been injured to help care for them. They didn't want to get separated any further. They had nowhere else to go, so they had come to the hospital as well. So you'd often have a patient, but then they would be there with maybe their mother and 3 or 4 of their brothers and sisters. All of them were there, and they had no access to food. And outside, was just, outside of the hospital grounds was just rubble. There was no access there. And to actually get to a distribution of food might have been a very long way to go, and it would have meant leaving the bedside of their loved one for quite a long time. So Mercy Corps, just seeing this as such a vulnerable community, stepped in right away and was able to deliver over 15 tons of food initially into the General Hospital. It started out with high-energy biscuits to folks, and pretty aimed at the children that were there. And then we were able to then increase our distribution when the warehouses and things opened up a little bit over the next few days, and started bringing in rice and beans and other dry goods, and worked with the hospital staff there to have them actually cook hot meals and get those hot meals out. And that was something that I think was just a huge, very early intervention that really helped some of these families that were in such an incredibly difficult and painful place, and really in some cases had no one caring for them. Actually, this here was just an orphan, and just there were so many children that were separated from their parents. They might be orphans, we don't know at this point sometimes, they need to find that out, but there were just so many people that weren't able to get their own food that Mercy Corps really stepped in there and focused on. And it was rough going in those first few days, just in terms of the logistics of getting that food out. Something that under normal circumstances it would be a pretty straightforward operation. Took huge amounts of coordination. We were actually working with the World Food Program because they had existing warehouses of food in the country. And at that time, getting flights in with aid shipments, cargo shipments, was very difficult. The airport was backed up. It still is today, but then we were looking at several days until shipments could arrive. So we were able to partner with the World Food Program, who doesn't have a distribution component, but they actually had food in their warehouses. And we organized the trucks and organized with the General Hospital staff to actually run these distributions and get everything out in an orderly fashion. And again, this was at the point where there was an awful lot of concern about the security situation, particularly around food distributions. There had been some where there had been some crowd control incidences. But in terms of Mercy Corps' experience, I think part of it's because we had people that were extremely experienced at food distributions running this. Some of our emergency responders have done this around the world, that they really knew how to go about it. And we never had any security incidences in terms of our food distributions. So that was something that I think was really positive because I think other organizations started to see, oh, you can actually get out there and distribute food. Some had been holding off. They were concerned about security. And I think when they started seeing the successes that we were having in some other organizations, that it sort of opened up everyone to getting out there and doing a lot more food distribution quite early on, which was so important. And then the other thing that Mercy Corps was doing at the hospitals was putting in water filtration units. And we brought those in from outside the country because the hospitals have very high standards for water. In the communities, we were able just to treat the water. But in terms of hospital needs, we actually had to put it through a water filtration system. So Mercy Corps has been installing water filtration systems at some of the hospitals that didn't have access to good, clean water. And so the healthcare system has been a real focus for Mercy Corps, and we've been able to work in partnership with an organization called Partners in Health, which has been in Haiti for about 20 years and is really a wonderful organization that has been a great partner and colleague agency in this response.